Hello and welcome to the Nurse Station. My name is Ryan Mobley and we are currently in this mini series where I post a question, you pause the video, break it down, and then I'll show you how I break it down. Okay, so pause that video and do this question. So there's a key word in here that completely changes your topic according to Maslow's. Remember, step one for every prioritization question, so I circled the word that shows you all answers could be correct. We got to get to the best answer. Remember, again, the NCLEX will bold those key words. Now, the home health nurse is caring for a client diagnosed with stage 4 lung cancer in hospice care. This was the word that completely changes this topic according to Maslow's, all right? Upon assessment, the nurse notes, you are the nurse in these questions, so you can trust this data. You assessed it. It's a perfect world. Upon assessment, the nurse notes labored breathing, a respiratory rate of 8 breaths per minute, and a complaint of severe pain rated 9 on a scale of 0 to 10. Now, I'm just going to explain something, all right? I'm going to draw my little Maslow's right here. Y'all remember how I do A, B, C, D. A lot more physical things that could be outside of that. Safety, psychosocial, and I kind of treat pain right here, right? And if you haven't, I'm sorry, pain is in between safety and psych. Again, how did I teach with this handwriting? I don't know. But if you have not seen my Maslow's video, I really encourage you to watch it or find a Maslow's video that works for you. Every question, step one, is identify the topic according to Maslow's. So if you focused on breathing, my question to you, a hospice patient, when they are given and provided that type of treatment, are they dying? And the answer is yes. Traditionally, it is deemed that they have less than 6 months to live. Now, is physical the priority for patients in hospice care? Or is pain, the top of the pyramid, pain and psychosocial, the priority of hospice care? And I'm going to tell you, I've never worked for hospice, but I've treated patients on my units that are in hospice care, and I've cared for them as they've passed away. I just had a loved one placed in this care, and I'm going to let you know, your priority as a nurse is to allow them to die with dignity, and you try to keep them as comfortable as possible. They are dying. Physical needs is no longer your priority. So if you focused on breathing as your priority for an actively dying patient, I'm going to let you know that is not the priority for hospice care. I would have focused on pain. My priority for this patient is right now pain. Meaning, I need to find a right now pain intervention. If you focused on breathing, you might have said risk of breathing because you don't have a pulse ox yet, and you might have gathered pulse oximetry, or you could have said right now breathing because of this respiratory rate and maybe reverse them. I'm going to let you know, and this is a really good conversation I have with my students all the time, that the priority for a hospice client is not physical care. We do not prolong their life. We don't keep treating them physically. We give interventions to provide comfort, and we want them to die with dignity. That is your priority. So it changes everything, okay? So if my topic is right now pain, I need a right now pain intervention, all right? So first we're gonna label them assessment versus intervention, get rid of our assessments, and then we're gonna pick the answer choice that matches pain. How can I help my patient in pain? So administer naloxone is an intervention. Educate the client that additional pain medication can be administered when their respiratory rate increases to 12 breaths per minute. That's an intervention. Administer the prescribed morphine immediately. Intervention. Administer oxygen and notify the healthcare provider. Intervention, and this is your assessment. So you can get rid of that one. Now, which one helps this patient with pain? There is only one answer choice that helps this patient with pain, and the best answer is C. And again, I want you to look more into the priorities of patients in this care. And again, it is to allow them to die with dignity, as comfortable as possible. I am not going to withhold pain medicine from an actively dying patient, severe pain. That is not how we treat these patients when it comes to the end of their life. So I just encourage you, you don't have to agree with me. This is always a good conversation and a question I pose every time I teach about hospice care to my students. So just look more into it, but this is the answer choice I would pick. If you need any more help with Maslow's, you can look in the description of the question. I've also posted a much more detailed video explanation of how to break down this style. As always, I hope I've just helped you a little bit. And if not, I just encourage you to find a way for a question breakdown. Take care.